All of you are in the WhatsApp group for the interview preparation for the
Yes.
one for Sudanese Association Physicians.
Yes.
Okay,
I guess.
خلاص. I just wanted to make sure because they are doing great job.
They are actually.
And a lot of Sudanese applicants this year, mashallah.
Yeah, I've seen that.
I think we can start, and then we can let the other people join as time goes along. If they cannot join, then they can look at the video later. Assalamu alaikum. Hi everyone. Today we can talk about how to read a scientific paper, and the presenter will be Dr. Omia. And it's up to you. Go ahead, Omia.
Okay, salam alaikum everybody. I will be presenting how to read a scientific paper. It's a very big topic, but I tried to touch base on the important things, and I will try to share you what I'm really doing while reading a paper. So, reading a scientific literature is mandatory for researchers and clinicians. With an overflow of medical and dental journals, it's essential to develop a method to choose and read the right articles. So my objective is to outline a logical and orderly approach to read a scientific manuscript by breaking down the task into smaller step-by-step components. The one should be able to attain skills to read a scientific article with ease. So the scientific literature is burgeoning at an exponential rate. Between 1978 and 1985, nearly 272,000 articles were published annually and listed in Medline. Between 1986 to 1993, the number reached 344,000 articles per year, and between 1994 to 2001, the figure has grown to 389,000 articles per year. To be updated with the current knowledge, a physician practicing general medicine has to read 17 articles a day to keep up with this rate of publications. So why do we need to read articles? So Sackett, 1981, and Durbin in 2009, both of them did studies about what are the reasons most of us read scientific journals, and most of the reasons were listed in this table. So the first one is to update oneself with the progress in a particular specialty field of study. To find out a solution for a specific problem, could be diagnostic or therapeutic. To know about causation, clinical features, and course of a disorder or a disease. Hello?
Hello, yes, go ahead.
Just
You can hear me? Okay. To understand certain fundamental aspects like pathophysiology, to get an idea for carrying out the research work. The article has been assigned to be read like by an instructor for a postgraduate student to find support for one's views and to impress others. What are the types of journal articles? So we have two types, either a primary research, this is the original articles written to present a finding of a new scientific discoveries or to describe earlier work, to acknowledge and place new findings in the proper perspective. The secondary research, this is the meta-analysis, the systematic review, whatever we do to reflect on the primary research, like books, editorials, practice guidelines, and other publications. So, what we consider as a primary literature, okay, as I said, original research article, survey, case report, case series, conference proceedings and abstracts, editorial correspondence, and letters to the editor. The secondary literature is like narrative review, systematic review, meta-analysis, guidelines, and commentary. So, what to read in a journal and how to choose the right article. So, not all research articles published are excellent, and it's pragmatic to decide if the quality of the study warrants reading the whole manuscript. The first step for a reader to choose the right article for reading depends on the one's individual requirement. And the next step is to read the selected article methodologically and efficiently. So from my own experience, I used to judge the quality of the article or the study according to the journal that it was published in. For me, the New England Journal of Medicine, I already assume that this is a good article, the BMJ, the JAMA, all of this. But when you go deeply and try to critically read the article, you will find out no, even those reputable journals are sometimes publishing nonsense. So this is the schematic to decide which article to choose. So the reader need to decide what is he looking for. If we're looking for idea for research, we look for original research, RCTs, controlled clinical trial, experimental studies, cohort, and case controls. If we are looking to solve a diagnostic dilemma, we look at reviews, proceeding, textbook, case series, case reports. If we want to review a topic for updates, we look at systematic review, meta-analysis, and narrative reviews. So, how to start reading an article? So the thing is that we have two steps in reading an article. The first step is to take a glance at the whole paper to decide whether we are reading the whole article or no. So at first glance, a journal article might appear very intimidating for some or confusing for others with tables and graphs. Reading a research article can be a frustrating experience, especially for ones who has not mastered the art of reading scientific literature. But once you learn to read it in a systematic approach, it will be easy. Most of the scientific articles are organized as follows. So we'll have a title, which will give the topic and information about the authors. We will have the abstract, which is a brief review of the article. We'll have the introduction, which is background information, a statement of the research hypothesis. We have the methods, details of how the study was conducted, procedures followed, instruments used, and the variable measures. The fourth is the results, all the data of the study along with figures, tables, and graphs. And fifth component is the discussion, which is interpretation of the results and implications of the study, and then the references and bibliography. So the main rule is we never start reading an article from the beginning to its end. We have an objective way to read the article. So what we do is we start by identifying the conclusion of the study by reading the title and the abstract. After that, we will decide whether we're gonna proceed to read the whole article or no. That's why, guys, the title of the study and the abstract are the most important piece of information, and this is a piece of information from the article that's usually free. Most of those journals are subscription journals. You need to pay money to look for the whole study. So what's available free online is the title and the abstract. Most of the readers are reading the title of the study, the abstract, and if it meets their objectives, they will go ahead and purchase the whole article. Okay, so this is a schematic how we're gonna tackle this. So first of all, we look at the title. Is the title related to the topic that I'm looking for? And does it have the keywords which I have in mind? If no, we skip the article. If yes, we will go to read the abstract, summary, or conclusion. If we have clear-cut aims and objectives, well-defined research hypothesis, are the conclusions precise? Is the above useful or relevant to what I'm looking for? If yes, we're gonna read the whole article. If no, we will skip it. Okay, so at this point, we decided that we're gonna read the whole article, then we'll go from the beginning. Okay, so the title. A good title will inform the potential reader a great deal about the study to decide whether to go ahead. Hello?
Yes, we can hear you.
Okay. So a good title will inform the potential reader a great deal about the study to decide whether to go ahead with the paper or to dismiss it. A good title has to be descriptive and self-explanatory without having to look at the entire article to know what is all about. Okay, so this is an example for a study. Effects of risdiplam treatment on vertebral and non-vertebral fractures in women with postmenopausal osteoporosis, a randomized controlled trial. So this is a good article. It gives you the whole information about what you to expect. Okay, but if it was just effects of risdiplam treatment, that's it. This will be a very short article. It's not appealing to the reader. Then the next step is to read the abstract. So most journals, as I said, provide the abstract for free, and most scientific journals have a structured abstract with separate subheadings like introduction, method, result, and conclusion, making it easy for the reader to identify. And this process of the abstract, we call it the MRAD. Okay, so MRAD means introduction. So in the introduction, what are we looking for? What is the context of this project? How does it fit with other research topic? And what is the research question? Okay, and this will answer the why question. The methods will answer the how. What did the author do to answer the research question? The results, what was the answer to the question? And this is often shown in tables and figures. And this is the what, and so what, this is a discussion. What is the significance of this project? How does it fit with what else is known about the topic? And in the discussion, you need to decide whether this article is making sense to you or no. I will go in details in each of these items. So this is a picture of the abstract of the risedronate study. So they clearly stated their objective to test the efficacy and safety of daily treatment with risedronate. Okay, then they put the headings: design, setting, participants. They talked about the intervention, the main outcome measure, results, and conclusion. And this is what a good abstract should look like. It's like a summary of the whole study. It will give you idea about it. So I will start the MRAD, the introduction. The purpose of introduction is to provide the rationale of conducting the study. To do this, introduction typically follow a three-step deductive pathway. So to design a good introduction or to read a good introduction, it should go from a bigger concept to a smaller concept. So we start by what's already known or well established about the topic. This will make the background. What's not known to the topic, which is articulated as a gap statement. And this is the most important thing. A gap statement is the area we are from the knowledge that we are trying to fill by conducting research, and what the researchers did to address the gap. And this is the response. All this should be stated in the introduction. The reader should also determine whether a research hypothesis was stated and later check whether it was answered under the discussion. So next is the materials and method. So in this section, we will give the technical details about experiment and how it was carried out. Provided information should be detailed enough for the reader to understand how the study was carried out, like information about number of subjects including the study, their categorization, sampling method, inclusion and exclusion criteria, and the variable chosen. And believe me, guys, don't assume that the study is conducted well until you thoroughly read their methods. Sometimes after reading the methodology, like starting the abstract, you will think that this is a solid study, there is no glitch in it, it's good. But when you dive into the methodology, you will find like they have a specific sample size predetermined like 300. Then you will be surprised that they took a sample size of 150, which will not be an enough sample size to gain their predetermined power, and their study results will not be as accurate. Okay, and sometimes they don't bother even to explain the drop rate. Like they will start with 300 participants, and at the end of the methodology, you will find they are dealing with 120 without clear explanation what happened to the 180 participants in the middle. Okay, then at this stage, the reader should be acquainted with procedures and equipment used for data collection and find out whether they were appropriate. And at this stage as well, pay attention to the time of the study itself. Sometimes they will say we are going to recruit for 18 months, and you will find out that the study at 18 months, half of sample size was not collected. Some studies, especially the drug studies, will be ended early because of side effects, because of lack of fund. All of this will create issues. So we look at these issues at the methodology section, and we see how they dealt with it as the results section. And at the end, they need to bring this out in the discussion. The safety monitoring, the sample size, problems, the selection, and the fund issue, all this should be discussed twice in the method section and in the discussion. The other thing, results of the study. So in this section, the researcher gives details about the data collected, either in form of figures, tables, or graphs. Ideally, interpretation of data should not be reported in this section, but statistical analyses are presented. So at this stage, the reader should meticulously go through this segment of the manuscript and to find out whether the results were reliable, it's the same result over time, and are these results are valid, So the measure, validity means the research measure what it was supposed to measure. An important aspect is to check if all subjects present in the beginning of the study were accounted for at the end of the study. And if the answer is no, the reader should check whether any explanation was provided, as I said in the beginning. Okay, the other issue in the results section is regarding the outcome measures. Sometimes when the researchers are presenting the results, they tend to change their outcome. So in any study, the outcome should be predetermined at the time of the study design and at the time of the proposal. So what's happening, like if we have two types of outcomes in general. Either the study will be measuring a clinical endpoint like death, discharge, survival, uh, and we might have a secondary outcome or a surrogate outcome. Secondary outcome like time from admission to discharge, 28 days mortality, when we have a duration. And surrogate outcomes means like for myocardial infarction, the end clinical point will be doing coronary angio and check if the coronary arteries are blocked or patent. On the other hand, we can diagnose MI by a surrogate outcome like ECG changes or troponins. The difference between end clinical point and surrogate outcome is that surrogate outcome sometimes is easy to measure, and it happens more faster than the end result. Like for example, in cancers, a cancer diagnosis, the tumor markers might start to raise before, or mainly in recurrence, not a diagnosis, but the tumor markers are a good surrogate outcome for malignant activity. We will not wait for the tumor to metastasize all over the body to detect it, but tumor markers will raise early on. So the thing, what's happening in this outcomes, when the results came and the primary outcome is not significant, some researchers tend to put the secondary outcome, which is significant, as a primary outcome. So when reading a research paper, you need to check for consistency. Does the researcher carried out his primary outcome from the beginning all the way through, and it was the question he answered at the end, or no? And if they flip the secondary and primary outcome, why they did so, and did they explain it in the discussion or no? So results that were statistically significant and results that were not must be identified. And one should also observe whether a correct statistical test was employed for analysis and was the level of significance appropriate for the study. And it's very important to put in mind that statistical significance does not always mean clinical significance. So even if the article did show positive results, we need to critically think whether we can apply this knowledge on our patients or no. Patients are not like research. We need to consider cost, effectiveness. For example, if it's a survival analysis, if they conducted a big study and at the end the difference was like 1 week in terms of mortality, but the new drugs that has been used have significant side effects, their cost is an issue. 7 days is not a big difference. It is a statistical difference, but it's not a clinically significant difference. So finally, we will look at the discussion. Discussion, this is the most important section of the article, where research questions are answered and the meaning of the analysis and interpretation of the data are presented. Discussion usually is constructed in an inductive arguments. So in discussion, we start small, then we build up the argument. Okay, it's different from the introduction. In introduction, if you remember, I said we build up introduction in a deductive manner. We start big and we end small. So the inductive arguments of discussion means flowing from a study-specific finding to their greater implication and ultimately to a justified conclusion on the issue. They often follow 5 steps to establish the validity of what we know on an issue and how we will know it. So in the discussion, we should be provided with summary of the study main findings, comparison of these findings to those in the literature accounting for differences, counter evidence through assessment of the strengths and limitation of the rigor of research, assessment of the study's own limitation and strengths. This is accounting for the internal validity, consideration of the study's implication and generalizability, the external validity, and reaching a justified conclusion and take-home message. And internal validity and external validity are very important. Internal validity is looking at how the study was conducted and was it conducted in the appropriate manner. External validity, we're looking at generalizability and can we apply this study on general bigger population with different characteristics or not. And in the first place, if we have a problem in our internal validity, there is no external validity. So in order to be externally valid, the study needs to be internally valid and well conducted. It's important to remember that the discussions are the author's interpretations and opinions and not necessary facts. So we will read the discussion, but at the end, we need to have our own opinion whether this article or research paper attained their objectives or no. And are we convinced with their methodology or no? Are the results are reliable or no? The last thing is that reading the conclusion again. Though conclusion part had been read at the beginning, it's prudent to read it again at the end to confirm whether we had inferred initially is correct. If the conclusion has not made sense earlier, it may make sense after having pursued through the entire article. Okay, and this is the end of my presentation.
Thank you so much, Omnia. That's really great. It's very well done and summarized and stepwise good presentation. I really enjoyed it, and it's very, very informative. Great job. So any questions from other fellows, or any comments or any addition? Please step in.
Hello, Omnia.
Hi.
Yeah, that was really, really, as Dr. Nader said, great and informative presentation. And I think you are more than ready for the interview in terms of being relaxed, explaining every point. I really enjoyed it and learned a lot from your presentation. I'm trying to imitate Mulham feedback in terms of the PowerPoint. It's like brief stuff in the slide, but you elaborated more about the point that you presented. The presentation is really nice, easy on the eyes, the colors choice as well. And as I said, like you were very relaxed in explaining that. I think I'm giving my compliment now, and I'm nervous more than you presenting.
Oh, thanks so much. I appreciate it.
Yeah, that's really a good presentation. One thing that I will let you know that you need to put more light, as we learned from the last webinar, just like for the interview. Yeah, so, but the level, I think the level of your sitting and everything was good. The presentation was good. You're relaxed, explained everything. And I think that the only thing that I would say, like more light, that's all. Nice.
I'm working on the light.
Yeah, I know you will do that. So we know you. Thank you so much.
Thank you so much, Lubaba. Thank you.
Excellent. Thank you, Lubaba. Anyone else wants to add or ask questions or any comments?
Yes, I do have a question. Well, Onya, thank you so much for the presentation. It was really good. I have one question that is there's any like about research and stuff. So could it be only an abstract without a full text? Is that even possible?
Okay, so if I understood your question well, as I said, you read the abstract to guide you whether to read the whole paper or no. But if you are looking for inferences, if you're looking for like a background literature review, it's not advised to read the abstract only. So you should use the abstract as guidance. Are you gonna tackle and read
Yes.
the whole paper or no?
No, my question was,
Hmm.
can someone do an abstract only without doing like a whole research?
You mean the
with the full
writer?
text?
You
Yes,
mean
the writer. I'm talking about the author, yes.
As far as I know, it will not be named as an abstract. The term abstract is summary of a research. But what you're talking
Got it.
about, yes, is what we call is letter to the editor. So a letter to the editor, this is when you have like a diagnostic dilemma, a small case, you can put, it's not even a case report. And I will tell you the trick. Usually, I tried to make my presentation simple. I didn't want to overwhelm everybody with this, but
Sure.
I would just follow me, okay? So the thing is that, you know, the big journals, they have something called the impact factor. Okay? The impact factor is the reputable journals will have like impact factor of 30, of 35, like this. These are the New England Journal of Medicine, the ACP Journal, the BMJ, okay? And this impact factor is measured by the number of citations. They have some formula, number of citations per year multiplied by, I don't recall the formula exactly, but the issue is when you have a big research, it's more likely that people will come and check this research and took a piece of information of it and put it in their work. This is called citation, okay? Case reports, case series are less likely to be cited. Okay? So no matter what your case report and case series is interesting, the big journals will not be interested in it because it will be less cited and it will decrease their impact factor on a long term.
Got it.
But if you did this, like you have a very, very interesting case series and you put it like a letter to the editor is not counted in the impact factor calculation. And it is a publication. And those journals, they do accept it.
All right, thank you for
You got
clarifying.
my point? This is the trick. So this is the difference. You cannot do abstract without a research. An abstract, this is a summary of your research.
Yeah, correct.
But if you want to do like a brief thing, a letter to the editor will be your... and this is actually what we're doing now. I used to love reporting case reports, but the problem we will have is that we're publishing in a low impact factor journals, which is not good. But now we are learning to send a letter to the editor. You can, if you have an interesting case or a case series, you will target a higher impactful journal and they will accept it. I hope I answered your question.
Yes, you did. Thank you. That was a really basic question. Sorry. Of course, it's a summary of a research. It's just like I forgot that for a second, but yeah, thank you for clarifying your point. Thank you.
Okay.
Excellent question and excellent answer. I'd like to add also 2 points in addition to what you said, Omnia. the letter to the editor, sometimes it's easier if you want to read an article and then comment from your experience on the article. So let's say there is experience in telemedicine, let's say, and then came an article about telemedicine on older adults. So I can write, I will read that article carefully. And if I have some comments, let's say I'm looking at the numbers and the statistical analysis, and I came up with some critique, or maybe in my experience, I have find something different, then I will write the letter to the editor regarding that article mentioned in the journal. And with that, I will make my comments, like in their articles, they mentioned this method, and we think that method is better, or in our experience, we find that the way to do this is different, or the impact is different. So you can write some short couple of paragraphs regarding the letter, the journal article, and then send it to the editor, and they accept that. And in fact, when I joined the residency in my second year, one of my colleagues did this, and I'm like, wow. He commented about one article or one study, and they accepted his letter of to the editor. So it's an easier way, but you need to know what you are talking about, and you need to, as you said, Omnia, analyze the article very well, and you want to add to that, so they will accept your. The second part to the question, Dalia, if you only want to write an abstract, that's when you want to present in a conference, when you present your posters, all these posters, some journal will take this and put it in an appendix or a small supplement to their journal volume, and these abstracts or posters will present it as abstracts. Remember, when we started, I sent you 2 files, PDF, including some abstracts from medical students and some residents. So all these abstracts, mostly all of them are presented in a conference or international meetings. So they collect all these and put it in one single supplement to the journal, and this will be the abstracts. So it's an easier way if you want to publish as well. You want to see which journal get their abstracts from the meetings, and then you send a poster presentation, and it will go right away to the supplement, and it will be published as an abstract only. You don't have to publish a paper, if that makes sense.
Yeah, it does. Thank you.
You're
but
welcome.
I have a question about the letter for to the editor. So after they accept it, are they going to do any change on the research or the abstract? Like as you said, your colleague in residency, he sent a letter to the editor, and they accepted. Okay, so what's after that? After they accept it?
So this is what happened. It's similar to what we are doing now. Omnia presented this presentation, right? She has, let's say, 30 slides. So you comment on the last slide, which is reading the conclusion, and then you come up with, in addition to this, we will add 2 other points and send it to me. In the journal, when you send the letter to the editor, they will add it to the next journal volume or issue. And so it will be after the fact, after the article is published. So the authors of the paper, which is published, they will not change it. But the editor has the right to comment on your comment. They will say, we agree with the 2, let's say my colleague who presented the letter they will say, we agree with this, and it's a good addition to the article as far as new information or new experience or something.
So it's just an addition. It's not like they are antagonizing it or something like that, correct?
It can be a point of difference, and you can present that, but it will be too late for the authors. And sometimes they can let the authors respond to this. So the editor will send these letters to the authors so they can respond to this, because sometimes they don't present all the data they have in the article. They might have some extra data or something else going on, so they will clarify that according to the letter that you send. So it will be a response to the response. Sometimes this comes from the authors, and sometimes it's just from the editor.
Thank you so much.
You're welcome. Excellent. Any other questions, guys?
Assalamu alaikum.
Alaikum salam rahman. Go ahead.
First of all, mashallah, very great and enjoyable and informative presentation. And it had a mix between summary and detailed explanation. And yeah, as Lubaba said, great job, mashallah, from Omnia. She did everything, summarized very well. Did the variation between statistic significant, not related, or it doesn't mean it's equal to clinical significant. And she explained at the end the impact factor. And as Lubaba said, the lighting, it's very crucial, especially for the interviews. Yeah, it's very important. I think one term you didn't add there, which is limitation of the study. You could have said that, but he explained it, the point, which is what is a limitation? Usually in studies or in journals, they would add in every research, not every, most of it, limitation. The researcher would mention limitation. So what is that? So limitation is a researcher would say, my study, they would critique their own study. They would say, my study is good, it's great, please cite it. But then again, of course, they won't use that terms, but the way they would explain is, this is bad, this is bad, this is bad. Sometimes it will be only 1 point, sometimes 2, sometimes 3 points. Based on it, us, the ones who are scientists, want to do some research. You read it, you say, well, based on what I've seen, the limitations there, this seems like a bad research. I won't use it. They need to be sincere. And this is what is limitation of the study. And she mentioned a good point there, which is number of people drop out, which is, for example, if it was, I think she said 500 and drop to 250, 50%. That's a bad research. The results will be impaired. You can't use that in your research. So that's one point. Yeah, all great. And thank you again.
Excellent. Thank you so much, Morham. That's really also a great point. Yes. So sometimes they mention the limitation, as you said. Sometimes it might be a minor limitation. Let's say the size of the participant might be small. Sometimes they may say this is study is only on these subjects, like patient with heart failure. So it's hard to generalize the study. Sometimes the location of the study, if it's in rural area, you cannot generalize it in urban area, something like that, or in younger patients less than 50, and then you cannot generalize it to patient older, like 60 and above. So sometimes they mention this in their study, usually before the end of the conclusion in their discussion part. Yeah, that's good. Excellent. Thank you, Mulham. Thank you, Omnia, again. Any addition or comments, questions?
Thank you, Omnia, for your great presentation. I really like it, especially the part like internal validity and external validity. When I started doing my research first, oh my God, it was very difficult for me to understand what exactly that is. but you really explained it very, like for the beginner, it's very, the way you explained it's very easy to understand. That's the part I like. And I think you're very confident. That's great. I mean, throughout the presentation, like sometimes, you know, in the beginning, probably we are very conscious and focused, but at the end, at the big, you know, in the middle, we lose our concentration. But I think your overall presentation is very good from the beginning to the end, which is very important, I guess, for the presenter as well as the person, the people who are listening to your presentation. And I think it's good for your interview also, because they want to see like throughout the interview how you know, concentrated you are, as this is like little bit different type of interview for all of us this time. Overall, it's a great presentation. I have a question for Dr. Nadir. As the data presentation, like I want to know, let's say for when we submit an abstract, probably we have 100 patients data available. So we may write the data, I mean, we may write the abstract and submit the abstract with that 100 patients. However, when we will do our real paper, probably we have 200 patients for the same research, and we include, if we include that data to our real paper, how does that work?
So there are two separate things. One, if you are going, let's say, for a national meeting, Geriatric Medical Association meeting that will be in April. So what happened is they will ask you to submit your abstract early. So next month, in a couple of weeks, they want you to send the abstract. So the abstract for that meeting, it doesn't have to be a complete study. You can submit what you said, your 100 subjects and what you think is going on. You submit your methodology and you leave the results analysis and some of the conclusion part out. You can mention that we expect something, and then you send your abstract. It's just to give them an idea of what study you are doing. And then if they accept it, you finish your study. And by the time come like April, when you go there, you will present the whole study in your poster. You will mention the 200 subjects, you will mention your conclusion, your analysis, everything. And this will be, as we said, might be accepted as abstract in their journal. On the other hand, if you are submitting an article, the whole study to a journal right away, then in that sense, you will submit both the abstract, which is the summary of the study, and the whole article to the journal. So at that point, you have to have all your numbers correct. You don't have to miss or say we are not finished yet. You have to finish everything and then submit the whole thing together. As Umia mentioned, the first part will be the abstract, and the second part will be the whole article, information about the background, the methodology, analysis, study, and then the conclusion. So in that sense, you don't have a room for changing your numbers, if that makes sense. So.
Yeah, that makes sense. Yeah, I was a little bit like I was not sure how does exactly that work, but yeah, it makes sense. But what I'm saying is, I mean, for the results, I guess like the more, I mean, you know, of course, the more number of the patient, probably that is more valid and accurate than the less number of the patient. So, I mean, my question is for, let's say for the abstract and for the poster presentation, if any discrepancy of the results wise, is that okay? They accept it?
Yeah, because the acceptance will be by the end of the period when they say deadline for abstract submission, let's say December 1st. So you have 2 weeks to submit your abstract. So after the deadline, they will review your abstract or the poster that you submitted. And they will say, oh yes, this is a good idea. and good thinking or good method, then they wait for you to complete it and present it as a full. So they waited. They wait until April for you to come up with the whole from A to Z your study. So in that sense, they don't change their mind. They already accepted it for you. Most of the meetings will either accept or reject right away the abstract for the poster presentation. So if that makes sense for you.
Yeah, that makes sense. Yeah.
Okay.
Thank you.
Thank you for the question. Thanks. Any other questions or any other comments or suggestions?
Hello.
Hello. Yes. Go ahead, Roa.
First of all, thank you, Omnia, so much for this informative presentation. I really learned a lot from it. You look very comfortable and relaxed, and wish you good luck in the interview. Actually, my question is for Mulham. I wanted to know when he commented on Omnia's presentation, were he looking at the camera or the screen? Sorry for this question. It's really important for me to know. While he was commenting.
What did you expect? Did you see me looking to the screen or the camera?
With this look, you seems like you're not looking at me. That's why I'm asking.
Yeah, I'm looking more likely front-wise, as if I'm speaking normally, not at the camera.
You're not looking at the camera or the screen, right? No.
Usually, when I'm speaking, I don't look to the camera. That's more easier, simpler. You're presenting something or speaking about something, so you try to engage. Then by the end, I try sometimes to look at the camera. So right now, I'm looking at the camera. You can't see me, right?
Yeah. Okay. Yeah. Thank you.
You're welcome.
We're getting crazy because of the interviews. Thank you.
No problem at all. And by the end, I will share my experience from the first interview, inshallah, today.
Okay.
Excellent. Go ahead, Omnia. You want to add something?
It's very difficult to adjust the angle of the camera. So we need to pay attention to this.
Yes.
I agree, Omnia, but I think they mentioned a trick. You can raise your laptop to the level of your, like maybe your chest or something, putting desk, maybe textbooks or anything to elevate your computer to be at the level of your chest. And then at this part, I think you will be able to be focusing on front of the camera. I think it needs a lot of practice from us.
Yeah.
Here last week, somebody suggested we need to be on the camera more so we can get feedback and give feedback for others. But I think this is one of the stuff that they talk about in the webinar.
Okay, this is good. I will try to do this.
Excellent. Good. Any other comments or addition or questions? Okay, go ahead, Mulham.
All right. Please, if there is anyone who would like to ask Omnia, ask, because we are entering into a different area, which is the interview itself. I want to share the experience. I'll just wait for a second to hear if there's any questions for Omnia. All right. So, alhamdulillah, I did my first interview yesterday. I feel I did well. Thank you. So there is two portions of the interview. So there is the day before, which is the informal interview. I didn't know what to expect, frankly, because it's everything changed. And this is my first year applying. But regardless, it's similar to what used to be the experience. I read a lot about the previous experiences. Similar, but you are in your home. So you need to make sure that you're comfortable. That's the goal. Rehearse earlier. Make sure what works with you. For example, the angle, the camera, the lighting, or the light or the lamp. and make sure, do you prefer headphones or not? This can irritate really. Now, the first day, it was the first time I tried a headphone. I never used that. I wasn't comfortable. So the interview date yesterday, I used a headphone. Sorry, I didn't use it. I was much relaxed. Now, this is preference. You need to know what works with you earlier. I did a mistake, which try something I didn't do. But then it won't work well, actually, the informal. Now, let me explain the informal meeting. It is an hour, usually at night. It can be from 6 to 8 or 6 to 9. What happens is you will be with a resident or 3 or 4, and your colleagues, also the candidates who are applying with you, will be there, and who are going to be interviewed the day after also. Now, they can be 9, 10, 11, or 12. So first, the resident, one of them would be like, well, you need to be relaxed. You should have worn pajamas or any. They would be in their pajamas, but please, we as candidates, we can't do that. We need to be very respectful, but at the same time, don't wear a tie. Tie is too much for the informal day. I didn't wear it. One wear it was like, sorry, I'm sorry, I can't apologize. So he was stressed, one of the applicants. One mistake all they did was internet. Make sure you already tried. You have plan A and plan B. He didn't have plan B. He wasn't there. Now, the day after, which is yesterday, they literally, 2 of the interviewers asked, how did you attend? They know that one of us had an issue. They want to know who was interested, who wasn't, who didn't have a plan. So they tried to ask a couple of questions, who involved, who was not. So be ready for the names of the residents, which shows interest. And I think that's one of the questions they asked. Now, the informal day, they said, first of all, it's very relaxed. It is not like Q&A. You will just introduce yourself. It's divided into 3 portions. First, my name is, originally from, I'm living here right now. Then you can add some funny fact about you, or a hobby, or an interest. So those are the 3 points you can share. Usually they would say something like, yesterday, the main topic, the day before, it was soccer. So that is good. They mentioned their interest in soccer and cricket and some other things. But that was the main thing in the residence. It's a very easy day, relax. And the most important thing is to have questions. Questions means you're interested in the program, even for the residents. So make sure to have at least 1 or 2, and it should be something like either research, if you are interested in research, but make sure it's not the same type of questions which are present in their website. So for instance, their site says, for example, we're embedded in research and so on and so on and so on. Ask more specific, which shows a genuine interest. Every word needs to be thought of very well. So take a pause when they say a question, take a pause. They themselves have issues in terms of camera usage. They won't look to the camera. Literally, none of the interviewers were looking to the camera. So that's why I was very comfortable speaking, just like what I'm doing right now, looking anywhere. But actually, I try to be fixed so that they know I'm looking to the screen. I'm looking at them. I'm trying to look at their facial expressions. I literally knew that sometimes, whoa, I slipped. Shorten the story. Sometimes you need to shorten your story quick because they're bored to enter new territory. For instance, I will give you an example. One of the interviewers, I was sharing a case. They asked me, I will share with you some of the points there, but asked me one bad experience, a good experience that I recall in the US in terms of clinically, because I said I did have experience. We all probably have. So if you say that, they would ask you. Now, I shared one experience of a patient, and then I told him I referred the patient for psychiatric evaluation, referred her, and he was like, why? I didn't give a reason. Then I was like, whoa, I didn't give a reason. His face changed. Then I recalled, yeah, I forgot the main point. The patient has suicidal ideation. You need to see the face because always there's something there. And this gives you a clue that you missed some point, actually. And rehearsal helps you, really. Rehearsal helps you to make sure that you don't miss the points. I didn't have time to rehearse much. I tried to be myself, genuine, sincere, not extremely sincere. This is very important now. Sincere, it means you're going through the points all over, being very friendly, being yourself, but then don't add too much. which makes you destructive. That's only thing I can say. Then what else? So that's based on the informal. On the informal day, I had about 5 interviewers. Yeah, everyone. That's a lot. Usually they say it's usually between 4 or 5, but I had 5 because it was a university program. So university programs are usually more embedded into research. So they would ask a lot. Yeah, all of us here, inshallah, we'll all get interviews, and you would be asked about Michigan State University. It's very interesting. I placed it at the end when they asked me about, please tell me about yourself. I knew it would be a bait. So they would ask about my research projects here in Michigan State University and my previous publications. They took the bait. They like to know what is that, because nobody has that experience, especially during COVID time. And this is the time to say thank you, Dr. Nader, for providing this opportunity, really, because it's very interesting and it brings the interest of all the programs to us, really. And please, all of us, make sure when you get an interview, you know what to say when they ask you about Michigan State University, because they have it in their CV or your CV. And when you start speaking, they would start thinking, what projects? What are you doing there? It's remotely. How do you do it? Explain your projects to me. Have you published? Now, if you published, they would enter into some depths. I think one of the interviewers would go in depth. That's the one who usually loves to ask about research, if it is a university program or affiliated university. Community programs, I don't think they go into depth into research, because they're most likely going to have you only have one project by the end of your resident there in that. So they don't really much enter into that area unless you have one unique research, for example, you published in COVID or some other thing that relates to their subspecialty. Yeah, knowing your interviewer is very essential. Now, I had the opportunity to know the interviewer names the day before that. Probably all of us will know that, inshallah, before you have your interview, they would send you their names. You would have a complete day, this is a lot actually, to read about what are their subspecialties. Now you can relate to them. Is it a male or a female? Now, it's very crucial that my first interviewer, actually, he was geriatric or geriatric subspecialist, so a specialist. So I knew that if I said, my preparation rehearsal was, when I tell myself, I would say tele program internal medicine department in Michigan State University. So they know I'm doing a research fellowship in Michigan State University. It's a tele program. I'm not mentioning geriatrics, so that I'm all over. So that if they think that I'm only focused on geriatric, well, you're very specific. We don't offer fellowship here. I thought of it in that sense. So that was my answer for almost the remaining interviewers. It was specific for this interviewer. I knew his name. When I started with him, I said, I'm in a tele-geriatric program. I said it slowly, and I took a pause. He was very interested. This is a start. There was a bond here. And by the end, I did form some bond with everyone. I tried my best. I don't know if I did accomplish that or not. Hopefully so. But your goal is to form a bond, and the best way to form a bond by knowing their name and knowing their background. That's literally goals here in America or any part of the world, because everyone wants you to say something good about them because they feel they have accomplished. Why don't you form a bond with them? So I think that's something to think of. What else? So yeah, all of us will be asked about research, especially that you mentioned it, and it's interesting. Then social cues, the face expressions, it happened to me twice. I tried to be very careful what to say and not. Usually with the first interview, you are more likely to do mistakes, but you try to analyze your mistakes. I literally wrote some of the mistakes, the body language, yeah, and exactly what Roa said. I thank you for that point. I literally never looked at the camera. I think I didn't look, actually. Yeah, I didn't look at the camera at all. I tried to have a fix on the screen. So this is my biggest mistake for the first interview. But I did engage very well in terms of body, which is I stood the way I'm right now. I make sure that my head, you can see it above, and you can see my face and my body. So that's important. So yeah, this is very crucial. And then move your body accordingly. Now, if you explain things, try to use your hand at times if it's needed to make sure that they know that you're very expressive. Hear and listen, be polite. And if they answer you a question based on your, they would say, please ask me a question. You need to have a question, at least one, and it should be different from one to another interviewer. If you don't, you can ask the question again. but never say, I don't have a question. If they ask you the first or second question, that's it. I want to say something there. Yeah, after responding to the question, say thank you. They like politeness, and politeness is the key they're looking for, because they're thinking of you as someone in their team. So looking sharp, smart, responsive, interactive, those are the things. The brightness, the lamp, as much as you can. The camera, yeah, the camera, you choose what do you want to use. I use my iPhone. I felt it's better than the iPad. I did this before during here when I presented. I tend to analyze every process whenever I do it. So every presentation I did, I focused on what I did good and bad. I tried to fix based on that. Now, what I noticed was the brightness and the camera. So I changed the brightness and the camera. I switched from what I was doing before to the iPhone. I think it's better. You should choose what works with you. Then again, if you're going to use the iPhone, make sure that don't be stressed. It will shift. You'll be shifted from one room to another. Yeah, I didn't explain this. So what happens is that in the day of the interview, you would be placed in a main room. Now, what is that? Main room is simply you would be shifted from here, A to B. They would ask you, do you want to be shifted? Don't say no. Say yes. That's the program coordinator would shift you. The day starts by entering a room. All your friends or the candidates there who are going to be interviewed with you in the program will be there. You would be mute or mute yourself is better. Make sure that your camera is very clear. Make sure it's, as we can, we were already rehearsed actually. Thankful to Dr. Nader, he provided this opportunity. So we already know how to use Zoom very well. So that's good for us. What I want to say is make sure that when the start, you can engage with the program coordinator. They will say good morning, say good morning. Some are stressed, they won't say anything. Be normal. Program coordinators are part of the team. So you need to be responsive, respectful, even to the program coordinator, everyone you meet. Hi, and you know the name and the pronunciation of the names of the program coordinator, the residents. I tried my best the day before to focus. I try always to focus on the detail because it shows your genuine interest in anything that you do. So make sure that you know the name and how to pronounce them of your interviewers, because you would say, hey, hello, my name is Son. You would say, hello, doctor, mention the name. My name is Son, and thank you for providing me this opportunity. And then you start responding based on the questions. This shows genuine interest, respectful politeness. After that, the program coordinator would discuss with you how the day would start. They would give you some introduction, and they would tell you that the program director would come in a minute or two and would start based on the schedule. Now, the schedule is a plan that they have made, very organized. I think every program would do the same process. They would send it the day before, early, probably 8 to 10 a.m., which shows exactly what are the things to be done. Yeah, and it will be very organized, and you have the names of the people. Make sure to review them, know their details, and pronounce them. That helps also because you interact with them. Whenever you say somebody's name, of course, they feel, oh, they know my name. That's important. The same, they're human. So make sure to interact with them as humans. What else? This is based on my experience, so I might be wrong or right in certain areas. Then I would say also, yeah, the most important and crucial question is, tell me about yourself. This is a question which is will be asked probably in every interview or in every interviewer, because in the same day, yesterday, I had about 4 or 5 interviewers. 4 of them, they asked me, they started with, tell me something about you, or tell me about yourself, or tell me about your background. Then you start from the start to the end. Everything should be mentioned in what you did first, high school, after that, and don't mention the names of the high school, and they don't know it, they don't really care, unless it's Harvard, Oxford, or so on. Other than that, something is not related to them, don't mention it. The names of the people from those areas, don't mention. Just, I did this, housemanship, I did this, I did residency here. Of course, for example, Dr. Omnia is in Hamad University. I think it's known. You can mention that actually, because I think it's known here in America. Say it. If they don't relate to it, leave it as it is. You just said it. Go further. Don't wait for them to respond. But there are certain areas when they say things, they would stop there. If they're interested in something, they would fix. I think from all the things I said, they focus only on Michigan State University, which I said at the end. It was my bait, literally. I thought of it as a bait, and they took the bait. And it took about 2 or 3 minutes to explain them. You should have reversed that. It can be a seconds, minute, or 3 minutes. Explain what was it. And so the rehearsal helps. Try to make sure you explain Michigan State University in a good manner and why you're involved, genuine interest in the program, that is Michigan State University. What are you doing there? What have you accomplished with them? And so on. Keep on going. And then they'll go towards other things. I had about probably 30 or 40 questions asked during this day, maybe more. I think 40. You can say, whoa, that's a lot. Yeah, but every interviewer has 5 to 6 questions, sometimes 10. It is the same questions which are present in the Facebook group residency matching. I think we are all involved. If you're not involved in this group, please be involved, as there's the file, 30 to 40 questions. I did use it. I think also Dr. Khalid Osman mentioned a Drive program or Google Drive, which has a lot of files. I haven't used it because I didn't have the time, really. I used to use the Facebook group. It's in the files. Inshallah, today I will share it with the group also, just to make sure that everyone has that, and rehearse very early to make sure that you're relaxed and smile. Keep on smiling, but not too much, because they'll be surprised. Wow, he's smiling too much. No. You want to smile at right appropriate times at the start when you enter the room. Make sure, because there is a shift between you enter the room, which you are staying in, towards the program. They would say you're entering the room of doctor. They would mention the name. So make sure you have a good smile, and then enter the room. Introduce yourself, keep going, and when you finish a question, try to smile also. That's actually ending a question by a smile is a smart way of saying I'm done. So by saying, so that's appropriate actually, and respectful and polite. So that's what they're looking for actually, and someone who's relaxed. Make sure always when you're sitting there, making sure you're adjusting to yourself at times, because you might be leaning forward. That's normal human behavior. Try to return back. Make sure it's very relaxed. You're very relaxed, and if you have tense moments, it's okay, very okay. Some questions are very tough. You get tense, you might speak faster. Try to relax. Take a pause. It's totally okay. Some questions need more thinking, and they will come out of the blue. I literally had 3 or 4 questions that I didn't have any clue. I would just mention what are they. I was surprised, but I was able to provide some good answer based on a pause. Literally, I took my time to think, and then I responded. I felt I did a good answer. How did I know I did a good answer? Based on their expressions. That gave it to me. And by the end, 1 or 2 of the interviewers said good, positive things about what some part of my experience. Now, I want to share this point also, which is if you have something really good, you need to sell yourself very well. If you have something good. For instance, I told you before about my experience about German. I speak a bit of German. So I knew this is something out of the ordinary, not commonly, everyone knows that. So I use that. Whenever they told me, one of the interviews, tell me something, I want to learn something from you that is non-academic. Can you think about it? Give me something. So I knew what I was gonna say, but as Dr. Nader said in the second session, please recall that, acting, there are some questions you need to act on. You already rehearsed everything, but the way you say it is all on acting. So I took a pause, looked down, acted as if I'm thinking. Here I wasn't thinking really. I knew what I was going to say, but then I started speaking. Very crucial. It showed that he thought about it there. It's something he really did. And I really did. I explained German, what its basis, some German words. I use a pronunciation, the German pronunciations, and interacted with him. I told him, please say with me this, and so on and so on. And by then I said, when he said it, I said, oh, you speak German. And we have a laugh at the end. Try to interact. If you're able to interact with them, there'll be at least strong bond build, because they think it's difficult for your side more than their side. So you're building that type of contact. So that's very important. And you try to do your best. Try to relax really and enjoy it as much as you can. It's easier said than done really, but being tensed, it prevents you from thinking, and it's all a game really, a game of thinking. If you're able to relax, you would know where they want to lead you, and don't be led. you lead them. Some question you can manipulate them. An example of a question which you can manipulate, the program director asked me a situation which was difficult to you. And yeah, so, please tell me a situation which was difficult to you and how you responded accordingly. So it's similar to a conflict, which is a similar question, which is very classic. They want to know a case and so on. So I manipulated the question a bit. What I said is, well, I don't do mistakes or conflicts because of my easygoing personality. But let me tell you what I will do if a conflict arises. Do you allow to about that? Now, why I did this maneuver, and by the end you've seen the portion, which is because I've seen she was surprised. Now, the way I manipulated the question, I knew I manipulated. She might also knew. She's an experienced interviewer for 10 or 15 years. So it's very tricky. Should I proceed or not? I took her lead and I said it in a polite manner. Will you allow me? She said, please proceed, with a smile, that she enjoyed what I said. And she also confirmed that I'm somebody who doesn't do mistakes and smartly manipulated the question. And then I mentioned that probably if a conflict arises, I would, the normal response, which really what we do in a situation, which is you take a pause, listen, and what else? You take a pause, listen, relax, and respond accordingly. Yeah, if there is, and yeah, the point of the question itself to see if we are responsible or not. I said, if it is me that I did a mistake, I'll be responsible. If I'm not the one responsible, I'll try to understand who did the mistake. But if it's me, I'll take the responsibility. I'll go directly to the patient and explain exactly what happens there. So, so she was like, okay, thank you for explaining that. I really need to hear that from you. So I think this is an important question which they judge you based on if you start it with them. What will you do? Will you go direct to the patient or hide the truth if there is a difficult situation? So that's the question. That's how I respond there. Anyways, I don't know if there's any thing I can add there, but this is literally my experience. Try to relax. It's as much as you can. It is stressful. It is very stressful, but rehearsal makes it much easier. Try to make sure that they know that you're able to communicate. Don't think about English as its difficulty or all that. Try to just speak. The most important thing is fluency. Try to speak a lot. Even if you do a mistake, try to fix it as you go. Rehearsal fixes that really. And if you have any question right now, or if you're going to have an interview next week or next couple of weeks and you want to discuss something with me, please, anytime. It will be my pleasure to help and assist. We are all together in this journey, and inshallah, we will all get the interviews and we'll get matched this year, inshallah. And thank you.
Thank you so much. This is a lot of good stuff. Thank you for putting all this together and sharing all these tips and experience. Really, I hope it will help all of the fellows here. Great. You mentioned some about the question about the case. Can you elaborate a little bit? Thank you.
Yeah, thank you. The case, so they didn't say directly in the case. One was the program director, she asked me about a difficult case that I encountered. That's where I manipulated it. There's different ways to encounter this question, but I prefer to move out of this area so that I'm not criticized based on my personality or somebody who did a mistake. We shouldn't take them based on that. So I left that area. Other case was another interviewer who was most likely based on research. He most of his question was based on research, but only one earlier question, he said, provide me a case you had here in the United States, which was very interesting. So here, my case, frankly, then my case were mostly based on outside the United States. But when he said that, I just recall a case on the spot. And the goal was to relate to a certain point, which is, by the end, I said compassionate and empathy, which is very important. Now, what they're looking for in a candidate is having certain characteristics, being good at team member, or being a good team member, working good at pressure or dealing with pressure and stress, and compassionate, empathetic. So I read about what are the things that they're looking for in a team member. And based on it, I made sure that I had a history, not anything which really I enjoyed or interested about, I would mention it. I showed the things which are based on good storytelling. This case is real, I would mention it. Please make sure that you have something similar or something differently, but it needs to be mentioning something by the end. So this case is a case I've seen in outpatient clinic. She came routinely multiple of times. Now, this was surprising to me because she is young, doesn't have any chronic illness, and this is her third. When I'm seeing the screen or electronic medical record system, it was off. And the doctor told me, Mulham, this seems like a mild case, not much really. Please see it. So I was fortunate I was provided this opportunity to deal with patients. So I went to the patient, I interacted with her. I felt something was off. Her mood was low. I felt there's something more because she came here for, let's say, 3 in the last 3 months. And I asked her what were her previous, why did she come? She said, nothing really. I just want to do some tests. I think I have something off, something like that. But the most important thing, that case was very crucial because I knew that, no, there's something more there. I kept on asking and asking and asking. By the end, by digging, I knew that her sister died 1 year ago, and she felt she was the reason behind it. This is what I actually said during the interview. And based on it, she actually started to have changes in her routine. No more exercising, gained weight, impaired sleeping. We know where is this going, right? SIGI-CAP. So this is the case I tried to mention, and I forgot to mention the suicidal ideation here during the encounter. And then I said, I went to my supervisor or attending, and I explained the case, and I told him, I think this patient needs a referral to psychiatric or psychiatric referral, because based on those points, he was like, he moved his head, so he was very irritated. So he was judging my clinical assessment there. So this was an important point for me to notice, whoa, I missed an important point there. I explained. The patient has suicidal ideations. This is the main reason why I showed this. Oh, all right. Then he said, all right, did you follow back after you left the clinic there? I said, yeah. Now, this part, I didn't like really. I lied about it. This is probably the only thing I lied about, but I thought that it's very crucial for them to know that I'm somebody who's empathetic and genuine, because when you deal with patients, you need to make sure that you follow them. I feel that, yeah, I didn't ask about her, the patient. I wasn't able to interact with the doctor himself again. Probably if I did, probably I would, like what we would do usually. But yeah, I did say that. I think it's very important. So that's why this is the part where sincerity is important, but not extreme sincerity. If I said that I didn't interact with the patient, they would say, no, he's not what we are looking for because he didn't look like an empathetic and compassionate patient. Oh, sorry, person. So yeah, that's the case. Hope that helps.
Again, thank you so much. That's really helpful and great to share. Thanks.
My pleasure.
Yes. Anyone else wants to ask Mulham or wants to add comments or anything unclear? Maybe some questions for Romnia, if there is.
I have a question.
Okay, go Roa and then Dalia.
Okay, Mulham, you mentioned that there is, I think, 3 or 4 questions that you were surprised with, and you forgot to mention them. So, would you please?
Thank you. Oh, yeah. I said that. So 3 questions are, first of all, how did you prepare for the interview? This is by the program director. I wasn't expecting that she would ask me about how did you prepare for the interview now. What she wanted to understand is my thought process. So I took a pause to understand what is her goal. Any question has a goal always. So I took a pause to understand why did she say that. Then I returned back and said, this is my answer. So I don't know if it's a great answer or a good answer, but it's not. I don't think it's a bad answer. So my response was, well, doctor, I mentioned her name. I think it's a very crucial interview for me. I'm very interested in your program. So I started first by when I had your interview email, I was very excited, pleased, and then immediately I started my planning. So I felt that strategy is very crucial for me. Number one, I made sure that I had the sample or the most commonly asked questions, wrote my story there, everything based on the my answers based on the question, and I started rehearsing daily for 2 hours from 10 to 12 p.m. Why I did that? I did it because this program is very important for me. Thank you. That's what I said. So I don't know if that's a great answer or not, but I tried to make it engaging. I think that's a very important thing for them to know that I'm genuinely interested. And I think she asked that to see if I'm genuinely someone who's interested in the program or not. So that's one of the questions which not classic questions usually. The second question, which is a feedback from previous doctor or any that helped you a lot. Now, this question relates to me a lot. I didn't prepare for it really. I don't think it's in there in the questions usually. So I can say my response. So I'm a person who's used to be very shy. And I would say I was an introvert. Some know this term. So it is introvert is just a personality. It's a normal. Before it used to be a disease. Now it is normal. We are all divided into introverts and extroverts. American culture is extrovert. They don't want any doctor who's an introvert. And we are a Sudanese population, and even Dr. Sumi here in Bangladesh, maybe they also know, maybe they are also introverts. So, but it's not the whole population that are introvert, but the major popularity of the parts of the people there are considered to be introverts. Now, introverts is a combination of things, including being shy, not likely to express their opinions, and so on. Now, that being said, so that's part of me when I was in college initially, and of course I'm explaining that to you. But what I said in the response there was I used to be a shy person, an introvert, and one of my doctors, he knew that I was able, when I interact with him, he saw that I was someone who was able to have good answers, but he felt sometimes I'm shy enough not to respond. So he knew that based on the interaction, and asked me, Mulham, please involve in presentations and involve more with the patients. You will be benefited a lot. I think that will help you. So I took that general experience to me. I took almost every week, I started presenting in college. That's where I formed this form of ability to present. It's something I really like. So from there, it kept on going. It helped me in terms of building my introvert to a mix between intro and extrovert. I want to say introvert is not a bad thing, but it's important to have some mix in the equation. It really helps. And then that helped me in terms of, and actually I enjoyed then the teaching experience. I let them know that that helped me in terms, and I gained a lot of teaching experience in Sudan, Saudi Arabia, wherever I was. I started teaching, because while teaching, you get taught, you learn a lot. Actually, that's a true thing. Whenever you teach, you learn more, and it gets fixed in your mind. So I let them know about that fact, and then I explain here my experience. Right now, actually, alhamdulillah, I started teaching 1 month ago in one of the big organizations here in America. So I let them know about that also opportunity, so they knew that I'm somebody who went from a certain phase, who improved based on a feedback, and it is a feedback. Now, you try to also relate. So you need to go to your history and share your story. But then again, write it down, think about it. Well, this takes a lot. It took me about really 4 days starting, because I had they sent me an invite day one. Alhamdulillah, I'm very really pleased and thankful that I had from day one. I'm surprised, still surprised, but I'm very grateful. Day one, they sent me the invite. I had a week to prepare. I didn't know where to start, but I started with the sampling of the questions, or the common questions that I've seen. And then I had 4 days of preparation. I think, wallah, it takes a lot of time and energy. 4 full days just to think about your story and your CV, what you might ask, what they want to ask, and still you prepare. Now, was that helpful? I think it was very helpful, because it took me a long time to prepare, 4 days, just to prepare that, not even rehearsal. Rehearsal is after, in the last 2 days or 3 days before the interview. So I didn't have the right amount of rehearsal, but the preparation that went into it, I think helped me to be a bit relaxed because my story seemed appropriate. I used whatever I had in the past to answer. Even though this question wasn't rehearsed, but I was able to explain it based on, I actually reviewed my history. I tried to recall what I did in school and everything. So try to go back to your past because it helps. The third thing is, yeah, I told you about the third case, which is a case which was interesting to me in the United States during externship. I wasn't prepared for that case, but I tried to relate to them based on the things which are making you a good candidate, which is usually there's about 5 or 7 or 9. You would find on the internet what are the candidates where they look for a doctor or residency, which includes, we already mentioned some of them: compassionate, empathetic, and someone who's trustworthy, someone who's sincere, someone who's professional, then works well under pressure, team working, experienced guy. What else? I think those are the things, but those are the 3 questions which were out of the picture, and you might have some like those questions are other side. Take a pause, think of it, and think of your experience. Respond accordingly, and make sure that the question that they asked, you know what is their motive, because there's a motive. Don't just answer it. If you know the motive, you know how to answer it based on your experience. And inshallah, it will be a great interview, bismillah. Thank you.
Thank you again, Mulham. And I want to add one big point is they want to know your way of communication. This is why you mentioned the last part is if you understand their question or the motive or what they want to look at, you will be better at answering. So communication, I think, is a major part. So when you do your rehearsal, or that will help you with your communication skills and be fluent and show them that you are thinking about the questions and answering in a way that easy to understand from their side as well. Thank you. Excellent points, Mulham. Thank you for sharing.
Thank you.
Excellent. And Dalia, I think you had a question. Please go ahead.
All right. Okay. Thank you so much, Mohan. That was super, super helpful. I really appreciate it. I really have one question about the Telegeriatric Fellowship. I still want you to talk about it more. Like, what should we talk about MSU, for example? If you haven't been there, actually, it's a virtual. So, what did they actually ask about? If you don't mind telling us.
No, that's all, Dalia. I'll explain. So, what they expect from us is to tell what we are doing right now at the moment. So, what Sumi mentioned earlier, I think 3 weeks ago or 4 weeks ago, which are our duties. I think she shared in the WhatsApp group that we do analyze projects and so on. So if you think about it, what are those points? I think it helps to start talking about what we are doing. And the expectation of us is someone who's involved in projects and indulged in a team association, and we're dealing with residents and faculty of MSU. Now, is this experience helpful in terms of research? The way I prepared my answer, I would share it with you right now, which is I made sure that it interacts, it involves that research itself. I'm involved in that part, but then again, I'm involved with the faculty, that is residents, fellows, and the staff, which I think is very crucial, so that they know that we are communicating with already at this level. Now, ask me about what do you do exactly? I'm interested because nobody is doing this activity. Now, this was one genuine question. So I said, well, Michigan State University is a big program. I'm very fortunate that they provide me this opportunity. and I'm already interested in research from a long period of time. So what we are doing right now at the moment, you always provide them the starting point, which is respectful to the organization you're involved in, never a bad vibe about any previous experience. That gets you out. You need always to be respectful, because every experience, we might have bad experience, but you never speak about them because you learn from them. So you never say bad thing about them. So speaking about Michigan State University, I said, as I said, the starting point, and then in this program, I'm very fortunate that we are meeting every week. We're discussing our projects, and one of the most important things here is our advisors allow us to communicate, engage very freely. We are able to speak our minds. We are able to share our projects, and then based on it, we're able to proceed further. Now, first, we start with a project, and number two, we start with explaining and making sure that everyone knows why we want to involve them in this project. Now, we are involved in certain projects. Those projects are, some of us, we already started, some others started, and we all go further from there. Now, one project, for example, then I started giving them the example. I said, for example, one of the projects we are involved right now at the moment, they are probably, as you know, they are all COVID. I made a smile. So you are engaging with them. They know, yeah, it's COVID. Yeah, it's COVID times. So then I said, it is COVID times. So it is related to COVID. So it's risk factor and COVID in the geriatric population. I made a communication with the one of them because I knew he's a geriatric subspecialist. So I made sure to say this research, which is risk factor. And I said it to all probably, the three, one of the three, I think, from the interviewers, because they were genuinely interested. I said risk factor and COVID relation in the geriatric population over the age of 60. I said, what do you do there? What is that? Well, I said, this project, fortunately enough, we got an IRB approval. We finished the first part of it. We are involved right now in terms of data collection. They said, what is the sample size of this project? Well, I said, at the moment, frankly, what I did is freestyling. Frankly, I didn't base it on things at the moment, but I said what makes it appropriate is saying a good number. For example, I knew based on research, yeah, you need to use your knowledge, previous knowledge of research or other things to say. Now, for example, a good sample, if you're not sure, just say 1,000. 1,000 is a good number. Now, I said 1,000 sample size is our project. And it is a big project. They said, whoa, really? That's interesting. Now, when you say sample size and you say the project and what you're doing, that you collected the data based on, you're giving them what is involved there. I'm not sure what I said really here. Sorry, I said questionnaire, actually. I said this is a questionnaire-based study, and it's a cross-sectional study. And it is a big study. It's a primary research. We're involved multiple, collaborating with multiple in the here residents, fellows, and faculty members. We're gonna do involved. Now, one of the interviewers asked me, "Wow, this is very interesting. A lot of information." Really, he was very interested by the talk there. We're involved at this level in research because most of the the ones who are applying are not involved in research. So that's very common that they would be very interested in it. So one asked me, are you involved in data analysis? I'm interested to know that. So frankly, at the moment, I'm not involved in data analysis, but I did have some experience before in college in SPSS program, but I want to be more involved in that area more in the future so that I gain experience in also that in that area because I want to be involved in all aspects of research. And frankly, yeah, I did involve in SPSS when I was college. I had a project there. So you try to use whatever you have from the past and return back to the future and indulge in the conversation. And to use your hands, I think it's helpful if you're used to it. If not, try to use something which shows true engaging with the interviewer because they love the interaction to be truthful as much as possible. Thank you. I hope this answers the question.
Yeah, it did actually. Thank you so much.
No problem at all.
Excellent. That's a good question, Daria. And thank you for answering, Morhan. That's great. Excellent. So I want to just reiterate what Mulham said. If you want to talk about Michigan State, you can see, you can look at the website or get more information. But you can mention that it's one of the top universities, and it's really working hard on the day or in the pandemic. And this is a great opportunity. And I think this is the first Telegeriatric Fellowship in the country. So the approach itself is unique. And you can mention what steps you have done so far as what we started. In the future, the requirement, as we mentioned, at least we want you to present a project, finish from start to finish, and present it in hopefully a national conference or meeting or symposium or a forum, and then you can be involved in more than one project. You can mention about your projects now. The things that in the future we want to do, as mentioned by Mulham, is we want you to gain the skills of the research and also to learn the tools that you will be using in research. So these are keywords when you're answering questions about research, because you had in your school some experience, maybe it's a very short or simple experience, but you want to increase the skills in that area, and you want to learn more about the tools that can be used. And by the tools I'm talking about, one of them is SPSS for statistics. If your institution or other area, there are different applications that can be used in statistics beside SPSS. The recent one is called JUMP. It's a new that's used in big universities. There is a newer version. It's called R language or R tool that can be also used. So in this fellowship, we can start working on some SPSS down the road, and if you have some time, we will learn some aspects of the other usage. It depends on what your interest, if you want to get detailed experience with this, but at least you will have the idea of using the tools when you're doing your own project in the future, hopefully. Then also you can mention about the discussion, the presentation, and the skills about how you present yourself, how you do whatever other skills, PowerPoint presentation, online presentation. And one thing we want to do is working in a group. So we divide into teams, and then you can mention about the leadership skills, and you just try to as much add things to the discussion. So it will drive some interest. So as Mulham said, you want to lead them when you give them the answer to the question they ask you. So it's kind of a skill in itself when you're answering questions. Thank you. Any other questions or any other comments? Yes.
Hello. Yeah.
Hello.
This is Rayan.
Rayan, go ahead.
Yeah. I sent some questions on the chat. If you please could reply to my question, and for one for you and one for Mulham too. Thank you.
Excellent. You want to look at that, Mulham, and then I will follow.
Okay, thank you, Rayan. Frankly, when I applied, I had no idea if I was an exceptional, I was a good applicant. I knew just that I need to make sure that I have a mix of experience. Now, I did start planning 2 years ago, 3 years ago, coming to America. My plan was, I'll be genuine here speaking with you. I was told, stop your dream of America. You have low scores. I'm someone who's with low scores, who told to stop your dream of America, and you are not good enough. So all that, yeah, that's very common to hear in life. But then again, your dreams and how stubborn about your dream should push you always to achieve that. So what I did is, knowing that I have low scores, I knew that I need to make sure that I gain new skills. So that's why I was generally interested in research, and started building up 2 years ago, and kept on reading more and more and more, and started reading research. And as you can see, I always almost have to jam in front of me to read just something that I gained interest in. That skill helped, and even during interview, they knew that I'm somebody who knows about research and published. Not many, I'll be frank here, but I'm someone who knows about research. That's something that I really liked about research. Second thing, I have taught, teaching in Sudan, Saudi Arabia, and here in America. I'm teaching with Kaplan. Someone might know Kaplan. I think everyone knows Kaplan, yeah. So that's why they could communicate with me about Kaplan. The third is, I teach step 1 and step 2 CK, so that's the thing. Third is I volunteered with American Red Cross, which is something, frankly, when I came to America, I was like, no, there is no need for it. But when I started reading, I prefer reading and analyzing things and discussing it with my own, excuse me for that, but yeah, I do that. So I searched a lot of experiences, and I did that actually genuinely because I was always told not to come to America. So I felt I should discuss with my own, because no one will gonna give me the energy. You need to be motivated, right? That's very crucial in life. So I read a lot of experiences. I built up a lot based on what I have, based on my scores. I knew that the only way into the system or the residency in the United States for me, someone with low scores, is making sure that, number one, I don't require a visa status. I think that's a visa status is very important, not to need it. Second of all, to be involved in research, and the number that they look for is usually 1 to 2 years, is very crucial. I don't have that experience, but I have less than 1 here with Michigan State University. Thank you, Dr. Nader, for that opportunity. And third is volunteering experience. I did it with American Red Cross, which they enjoy, especially it was helpful because it's during COVID and before COVID, which shows someone who's genuinely interested. I didn't start during COVID, I started before that. Teaching experience also. So I'm someone with variability. I had different variations. I didn't know if it really helps or not, but based on the previous experiences, I know that most who are involved had 3 out of the 4 that I did. I did more than what people did in terms of building up their CV, having low or red flags based on my scores. So based on what my previous experiences, I knew that people would get somewhere between 5 to 10 by the end of the season. And I can tell you, I'll be genuine here. I'm not bragging or any. Alhamdulillah, thank God. At the moment, I have 4 interviews. I'm surprised. It's the first week. I'm genuinely surprised. But I think what makes them interested in me is the variation, more than my scores, and the things I discussed. The 4 things, yeah. Thank you. Hope that helps.
Yeah, thanks, Mulham, for sharing.
Anytime.
Excellent. Thank you for sharing, Mulham, and discussion. The other question Rayan was asking about, when is the time, or when do you think the good time to send email programs to show your interest? So if I understand, there are 2 ways. The first way is what you can do, all of you, is after the interview, you want to send a thank you email to all the program director and the 3 or 4 other people who interviewed you. And as we mentioned before, try to take some notes when you write the email. Thank you note it will be great if you personalize that to the interviewer so that they can remember you. So that's in the past it was a thank you note. Now it's an email. The other question or the other way to answer your question, if you mean to send emails to the program before interviews, do you mean that, Ryan?
Yeah, right.
Okay. So if
yeah,
you
applicants
mean,
usually.
yeah, I think most of the program, I might be wrong, but most of the program use the ERAS. So even if you send an email, they might not look at it. You can do, however, try to send emails to some people who are in the area of the interview, if you know some. Like if you know Mulham had interview with certain people and you can access their email, then you can send them and you say that you are interested. Then they will look at, you can provide your ERAS number. They look at your application if you submit your application to them. And then they will find if there is something interesting in your application, similar to Mulham, whatever they find interest in him, maybe MSU, maybe something else, German or something for that person. That might be a way. The other way is if you have connections, residents before in these programs, you can try to ask them to provide program director with your application or number that can help from inside. So these are the ways that I'm thinking about. In the past, in my experience, I used email. So what happened to me is I got first year, it's called transition year. At that time, I'm not sure if it's still there in the residency. But
yes, it's still there.
Okay, so you spend 1 year, and then after the year, you go to decide if you want to go to subspecialty. I was interested in neurology at that time, but for some reason, I didn't get the acceptance to the program. So before I finished my first year, I collected the emails for all programs in internal medicine in the US. At that time, I think 250. So I sent my resume and my letter of interest to them through email. And I got some responses and I got 2 interviews, phone interviews at the time. So my thinking for you, hopefully you will get interviews this season and hopefully you will match. But as a backup plan B, if you want to, on the day of post-match, you can try to send your application again or resume or to the program that they have some openings. And you can continue that until the day of June, when the resume starts, June or July. Because sometimes what happens is some of the program might interview some people and they match, and then something happened, let's say a visa issue, or they have family issue, or they decide to go to a different program. So this program who accepted them, they will end up with empty spots, and they need to fill that right away before they start the residency in July. So in that sense, if you send the email to a program that's in need and you already have all they need, then hopefully they can accept you. So this is plan B for all. I hope you don't need it. I hope from the start you get your interviews and match right away. Thank you for the question.
Thank you.
All right. Any other questions or any other comments? For
This
yes.
is Baba again.
Go ahead.
Yeah. Thank you so much, Mulham, and congratulations. This is a really nice experience. And as they say, like hard work always pay off. So yeah, I'm really glad that you shared this information about your low score. So it is not something that can hinder you from getting your goals. And that's really motivating and encouraging. Thank you so much. I appreciate it. I do have a comment regarding the question that you are not expecting. How do you prepare for the interview? I feel like we can add to this, to the answer, that the new technology that we are using for the interview, how are we prepared for that as well, like talking about that point. And I like that, as you said, Dr. Nader, thank you so much for the opportunity. This is really something unique and first time happening, and it's really much needed at this time. It prepares, we can add, we were talking about Michigan State University as a reputable university, and I think that they focus about this because this is a university that they know about. So we need to highlight that much in our introduction at the beginning, and talk about the experience and how this experience actually prepared us for the interview itself, in terms of for the future of practice of medicine in the States. Now telehealth is being considered. Maybe it's going something to here to stay. So we are prepared in that sense. And I think we can add that to the question for how do we prepare for the interview, in addition to our regular preparation for that. The other thing I like about your answers, that you talked about your personality and how that changed with time. And I recently learned about the personalities, and I heard it from my kids too. And one of the really interesting things that I knew about it is like Nelson Mandela was introvert. So I think if we know some like known people having the same personality of us, we are, I think we have the ground to brag about that. Okay, they were the same people like us. So I think that's a really good point. And one of the I think Dr. Khalid Dosa spoke about that, and we need to go and search about personality and learn some things about it and share it in the interview. That would be very helpful. Would reflect that we are up to date. I'm talking about my kids knowing about this, so we better know about it too. So I think that's really nice experience, and really good luck for the future interviews and for everyone. And congratulations again, you deserved it.
Thank you, Lubaba. I appreciate that, really. And I would like to say that when there's this point, yeah, first of all, Michigan State University is in the top 50 universities, so it's a very big program. We need to make sure it's mentioned, and you try to say it at the end. That's the bait. It's very crucial to make it at the end. The last thing you did is, and say it very clearly and with a good voice, a loud voice, very clear. And make sure to rehearse a lot in that area. So they took the bait always. So probably would take the bait in your case situation. One thing I want to add, by reading more about the process, I knew that not all know about your CV now. I don't know if all the programs will do this, but the program that I'm involved with, I asked some of the residents there. I was able to engage with one of the residents there involved. I asked them or connect with them. So they said, no, only some know about your CV. And I think all the programs, they would do the same. That's based on their experience. So what happens is, and I think this is true actually based on the questions. That's why everyone will say, please tell me more about yourself. They know certain amount of information, except the program director. The program director, she was like, okay, all right. She was literally seeing everything. And what is more interesting? She went towards, she went to my personal statement. I didn't try to make the personal statement an excellent, because I knew I would make it a big failure. So I went to make an average, at least an average, but not an excellent, because when you go for excellent, it ends up bad at times. So that was my personal statement. She wasn't interested in that part. Letter recommendation, I think she was interested. She asked about, she said, I liked, yeah, thank you, Dr. Nader. She liked the Michigan State University letter. And she also discussed another letter that I had from one of the doctors who evaluated my work, who saw that I was a very hard worker. So even if it's an evaluation, not for a clinical, I think it's crucial if it is from a university program based on my experience, because I think they love that actually someone who had at least 20, 30, 40 years old experience in this industry or internal medicine expert evaluated me based on my CV and based on my how hard I'm working. And they said, Mulham is hard working and he did this, and based on the interaction, he seemed so on and so on. I don't know the content, but based on what they said, they told me, we will write something which mentions that you are smart and hardworking and all that, because we see that and we would help you. Anyways, if you know somebody who you interact with by emails or somewhere in I would say, excuse me, if you interact with someone who's actually in the conferences, I did interact with the conference. I was able to manage. I think you need to know the importance of conferences. And I will give you one help here. I always, whenever I go, before coming to America, I made sure to have this. Now, this is not what you think. I don't know what you're having in your mind, but I would say this is very crucial. It shows professionalism. I use it, and it was very crucial. Now, as you can see, I think you can see my name. It is Mulham Bada. Professionalism is something that they can see, perceive. In America, your appearance, the way you talk, the way you're dressed, and then again, it shows here Mulham Bada, internal medicine residency. I didn't apply to any family medicine. I had it in my mind. I was very stressed when I thought about I would apply to family medicine, but I can't see myself in that. So by the end, I always knew that internal medicine is my goal. I don't know if I will get matched. Hopefully, I would get matched there, and all of us, inshallah, will get interviews and get matched. Now, in the other side, I have my CV. Everything is written there. So I think this is a smart move. And I say that based on the reviews. The first review was from my doctors or my mentors in Michigan State, because every doctor we interact, teach us, they are my mentors, our mentors, and even Dr. Nader is our mentor. So I showed us first, I did a trial, frankly. I always try things. I tried this move, and I thought about it. I had different ideas. This one was one of the moves. I did in Michigan State when I was doing my externship there. They liked it a lot. They said, we haven't seen any doctor who did that. So I knew. They were surprised. They said, please keep doing that. It will get you a lot of likes, and it shows a true nature and smartness. So I was like, okay. I kept doing that. Whenever I went to, I engaged with any physician, attending, resident in every state I went. I went through 3 or 4 states. I was offered multiple of research fellowships based on that, but because they were in different states, when I went to conferences based on that move from doctors, they felt that it was smart and said, I want to offer you, but I wasn't able to take those offers, frankly, because they were financial burden was a lot. I wasn't able to travel there. They weren't going to pay for it, so I found it's based on one person to another to take or not. So that's why I'm very thankful for Dr. Nader's opportunity. He didn't need us to travel there. So it's a unique experience, and we won't find it really in any area. So thank you for that. But this move, I think, is very important, especially if you move to conferences, externship, and all that. I don't know if I'm the first one to do that, but I know that it was a smart move. I got an interview based on that. Yeah, one of my interviews was based on that. And it was my first interview, I think. Yeah, that was Ryan's message, that why I got it from the first day. I think the move itself was different. They lacked that, and that's why they offered me the interview. So yeah. Then also I would say you need to make sure that you go to your CV and look for if you have involvement with big names. Like, for example, Michigan State University, the big name, you try to say it and take your pause while saying it and rehearse it. Excuse me. Also try to see what else. For example, volunteering. I tried to volunteer with a big organization, American Red Cross. Teaching, I didn't apply to any except Kaplan because it's a big name. When you're involved in externships, try to go towards programs which have ACGME accreditation. That's important because you would be involved in day-to-day interaction of residents. That's what they're looking for in externship. Always you look for after what they're looking. What are the thoughts? Why they're looking for this? Because of that. So you go one step ahead, and that's the base of chess, I think. Even though I'm not good at chess, but that's just very important. Always go ahead, one step ahead helps you a lot. Please use that trick. I think it's a trick, good trick. I use it a lot. It helped me to get one interview. Maybe I'll get a second in the future based on that. I don't know. And one thing, check your emails at any time. I got one of my interviews at 8:30 at night. Literally, if I woke up at early morning, it was gone. Because when I woke up early morning, the number of interviews, the ones who are taking that went to wait listed. So make sure, yeah, based on what I've read before, I'll share this also point. I know that the dates that they send the interviews, most of the programs are, number one, somewhere between 8 to 9:30, then 11 to 1:30, that's common timing, then 3 to 5. Then some minimal programs would send you at night, which is 8 to 10. Those are the common times they would send. Now, you can check every 5 and 10 minutes, but those timings, you need to make sure you check every 2 to 3 minutes. Because when it send you, within 3 minutes, you need to enter. Sometimes you might find 3 or 4 spots, sometimes 1 spot. One of them, literally, I would say this, I entered, yeah. I would share also one point that there's 3 ways of getting an interview. There's Salamis, there's broker, or by the, all you would reach in your email, so you need to make sure you check your email. What is Salamis? Salamis is a broker. There's a second, which is interview broker. That's what you get in the, there. And those 2 are somewhere in between. So you are the candidate, and there's the program. So they would use someone in between to communicate to make sure everything goes well. So those are the 2 terms, Salamis and interview broker. Make sure interview broker is faster, because when you get a message, you will enter based on the link. There is a link, be relaxed, enter. You choose your date. There are 3 options. You have schedule, which is you schedule the meeting, and you get a confirmation in, I think, less than a minute. Second, there's wait list. So you can wait list yourself. Be careful. Schedule first, and that's it. Wait for confirmation, that's it. Or deny. So you have the option to schedule, wait list, or deny if it is interview broker. Now, the second option is Salamis. Salamis is a bit annoying. It took me about 5 minutes to understand the thing, and this can take you, so just prepare it, know what is the process for. So Salamis is they would send you a message. It is Salamis, not in our brain, that's different. But Salamis itself is just, as I said, it's a broker somewhere in between to communicate between the candidate and the program. What happens is you would click somewhere in between. There would be like, click here, you would click. You would need to sign in, have your AAMC somewhere written. I had it in my business card, but you need to have it there in front of you. This simplifies the process. They need the AAMC, which is present in your ERAS application. Have that, you would write that. You would write probably your email, I think. And no, the email will be there. I think you would add just one more information. The AAMC is the most important, your number, something like that. You would sign in. You would find that you have one application, one interview pending. Right, go for schedule directly. Higher up, there's multiple points. If you're on the page, you click whatever, it doesn't go. I wasted a lot of time just clicking. I'm waitlisted. Then actually, when I went up, I clicked. Yeah, it wasn't scheduled. Alhamdulillah, there was multiple of opportunities there. I clicked one of them. It went through. You will get confirmation. The goal is to confirm first. Don't take your time in it, because you might be waitlisted just by thinking, what should I choose? What are the dates? That comes after. Because when you confirm, then you don't find a date. You can go to the program coordinator, mention that you have an issue, you want to change the date. They might help you in that situation, because they do that really. But if you are waitlisted, sometimes it's difficult to return back to get scheduled. So confirm first always. Also mentioned the point about Salamis. Sorry, I have spoken a lot today. Excuse me, but I think it's very crucial. The last point here is one of the times that I confirmed, I try to confirm, I look towards the calendar. So it took me about 30 seconds, actually, I think. I looked at the calendar, I looked back, there was a drop of 3 positions. So you're not the only one who they send them an interview. Be careful. So don't take your time, because I've seen it. It was 6 positions. There were 3 remaining. I clicked immediately when I've seen that, clicked it, confirmed, and that's it. And alhamdulillah, I got that position. And inshallah, all of us will get interviewed, relax. But also there are tricks in the, bad maneuvers of people would do to stress people, which is in the residency group in the Facebook, they would say, if you don't get an interview in this week, you don't get any. Those are people who have bad manners, not respectful. They try to disturb people because they know when you're stressed, you want to prepare, rehearse, or any. Your goal is to rehearse. Inshallah, you will get an interview. Make sure that you start now to communicate with your contacts, and make sure you want to discuss with me. Inshallah, I'll try to help as much as I can, inshallah. And also, interview, send an yeah, this is, I want to give just a second there. Sorry, Dr. Nader, I took a long time today about this point.
That's very important.
Okay. I want to discuss the email, how to write a subject, because I got an interview based on an email. Yeah, so I think this is very crucial also. Now, when did I send the email? It's 2 days ahead from the interview date to the program coordinator. Now, it is important to understand there are certain rules not to do and certain rules to do. Program director, you can't send because it's considered to be against the law, not respectful and rude. So don't do that unless you know them directly or work with them. That's, I think, is very crucial. Now, the program coordinator you should send, but it should be unique subject. For example, I'm not sure, but I think, mashallah, Marwa passed her step 3 with a good scores a couple of days ago, mashallah, mabruk. I think you should use your subject there, step 3, or interested in your program. And in subject, you should say step 3 and mention the mark. That's one move, very smart. Everyone else, make sure what is unique in your CV. Now, if you have a great score in step 1 or step 2, mention them there. That's a smart move. They would look to your application. They would. Now, if they are interested in based on all your CV, they will give you an interview. What else? Also, if you don't feel that you have anything, don't forget Michigan State University. It's really big. Mention it. And the way to say it is Michigan or MSU applicant. Now, in America, abbreviation is all about abbreviations. It's not like they would say, no, they won't know it. No, they know it. MSU applicant, that's it in the bracket. Interested in your program. It's big. So say it. What else? And the way to send your message content is divided into 2 portions. That's what I did. You can do your way if you feel you have your way other than my approach. But what I do usually is, dear Mrs., about 95% of the program coordinators are females. So you can go with Mrs. and last name, not the first name. Respectfully, you go for the last name. Then you go for a formal process, which is a formal thing, which is hope you are well, or hope you are doing well. This shows also you're respectful, professional, and then you would say, I'm interested in your program. Please, the sentence here, it should be just small, 1 or 2 sentences based on what you have read in their program website. Wallah, they have a lot of information on their website and they're genuinely interested. Men responded. I didn't get all interviews from them, but they responded, thank you for your genuine interest in our program. What I said is, for example, simply, I'm interested in your program because you're highly embedded in research and teaching involvement and something like that, based on what I've read. I use the same terms in the first or second 2 sentences, then follow that by a summary of my CV. And I made 2 dots. I try to make it very, I always use a bullet thing because they don't have time. You need to always think of them. Whenever you're doing anything, you think of the other side. Now, when you think of them, you would know that they don't have time. So if you're doing it in a bullet points, it's very simple, easy to read, and artistic. So you would say, first, for example, don't write 1, 2, 3, 4, but in bullet points. For example, my step 1 score is this, step 2 CK is this, CS, if you did, it's a big advantage this year. So say CS, and then after that 4-point pass in the first attempt. This is important. They like that. So you need to mention. Then your graduation year, mention it. Based on them to say if they're interested or not. You're very frank here, giving them all the points. After that, current work. What you're doing at the moment. Sorry, yeah, the current work actually. You would say I'm involved with Michigan State University. If you're doing something else, mention it. Always summarized. And then the point after, which is visa status. No visa status is also very crucial. And experience. I said, for example, 3, you can say 4, 6 months. You would mention 6 months, USCE. Always summarize. US clinical experience. They know the abbreviation. So just use that. And after that, I said something, I think 1 sentence. Thank you for your time reading the message. This is a polite manner, and looking forward to hearing from you. Sincerely, you mention your name, and always try to use first and last name. This is especially for us as inshallah we'll be residents. As applicants, you would mention first and last name. The reason is this is the same names that you're using in your application. So you're promoting yourself. I started this ahead 1 year ago, actually. I kept on doing it regardless of whom I'm sending to. Always I do it. Whenever I'm presenting myself, I'm using that. So it's part of professionalism. And that's what people are looking for. Then mention your AAMC ID. It's very crucial because this is your ID for them. Mention that part at the end, and that's how you'll end your message. And inshallah, you'll get an interview this week, inshallah. Thank you.
Thank you so much.
Thank you so much, Mulham. That's really also great as always. I want to also remind you, all of you using smartphones, it might be a silly reminder, but you can use notification method in your phone so that you can get the email notification by sound or vibration or whatever, so that you can check your email right away. Because as Mulham said, 2 minutes might be too long if you want to check your email every 2 minutes, because you want to check it right away if it came your way, and you don't want to lose any chances or opportunities there. So, okay, any other comments or questions? This is really informative session from Omnia and Mulham, and great questions from the rest. Marwa,
hello.
Please. Yes, hello.
Hello, everyone. I hope you're doing well. I would like to thank Omnia for the presentation, although I apologize I came late. I'm stressed these days. Anyway, I would like to thank you, Dr. Nadir, really, and everyone, and Mulham for the very important points. I really can't thank you enough, because I'm in a situation like I just really needed these tips. I have a coming interview this week, and it's like it was in very short notice, even less than a week. So as you said, it's really important to check your email frequently. I just wanted to say one thing, because this is what happened to me. I got an interview. I got an email. I checked my Gmail regularly. So there wasn't like in the subject line, there wasn't like indication for this is invitation for interview. This is like they were like mentioning that they have changed their institute or program, change their sponsor or something from this group to another group. So I thought this is like maybe they're mentioning this to everyone. I wasn't sure, so I didn't check the ERAS that day. When I checked the next morning, I found out they actually invited me to an interview, and it was like as he said, everyone is gonna be like rushing, getting the spots. So I was left with the earliest date available. So just wanted to mention this point so everyone can pay attention to that. Please make sure that you read the messages on the ERAS, not just the Gmail, because it really wasn't, there was no indication of anything at the time. So you could just simply miss something by not checking. That's it. Thank you so much. I think the research opportunity at this research fellowship was, I would say, maybe a deal breaker, because I applied last year and I didn't, this was maybe the only thing missing in my resume. So I didn't get much, I would say, responses, and I was unfortunate to not being able to attend the interviews due to other causes. But anyway, I just genuinely thank you, Dr. Nadir. I think this is a great opportunity. We need to make use of it to the fullest. And good luck, everyone. I hope all of you get interviews and be happy at the end of the season, matching to a really good, great program. Thank you.
Thank you so much, Marwa. Thank you so much. And really, it's a good opportunity to work with you guys. You are awesome. And I think step 3 also is important. If you took it, some programs will look at that as well. But in all, I wish you all the best. Thanks. Any other comments from the other attendee, other fellows? Any questions for any of us? Only Mulham or myself or other? So it's almost 4:30 here in the US. So I'd like to thank you all. Quick question: what do we think we should do next week, next meeting? If you have any suggestions, one of my suggestions is to divide it into two halves. One half will be if you had an interview during the week, maybe you can come up with some summary or some tips like Mulham did, and the other part we can discuss something else. What do you think, guys?
I agree. Yeah, interview experience should be like part of the meeting. We learned a lot today from Mulham and looking forward to learn from others. Thank you.
Yeah, I agree too.
Great. So what do you think we should discuss next?
I have a question, Dr. Nader.
Yes, please.
About the interview again, when we're talking about the research, like for example, the risk factor of COVID in geriatric patients. So what about mentioning the sample size, like the detailed questions that he has been asked about? Like study.
Yeah.
Yes.
Yeah. At this point, we are in the process of getting the IRB approval from the hospital. So you can mention, as Mulham mentioned, you can give a number. 1,000 is a good number. And with the increased number of cases nowadays, it appears to be an okay number. So it's not that low and it's not that high. So you can mention that our target is the sample 1,000. So in the meantime, we are obtaining data right now. You can mention the steps of we discussed about the topic, the background. We are working on getting some literature review, and we processed the IRB approval from the institution, which is the MSU. Then we are getting the approval from the IRB from the hospital, Sparrow Hospital. And then when we get the data, we can use some data analysis tools. The SPSS is one of them. And then we have some people at the MSU. There is a statistics center where they have some volunteer or some people who can work with you. They are statistician or students, PhD holders, or working to get PhD. They are willing to work with getting the data analyzed. So that's the next part after obtaining the data. And the last part will be what and how we can present these results when we have the results. We can go for national conferences, and I think that's the time for that, for abstracts. And another option is to go directly to publish the data in some of the article or some of the journals as an article. But it depends on what's the results and how good or appealing these results are. Does that make sense?
Yep, it does. Yeah. And the IRP, sorry.
Go ahead.
So the MSU approved it, correct? And we're just
Yes.
waiting for the Sparrow Hospital.
Yes. And sometimes you want, if you have time, you want to give some details. So I would say like it's an expedited IRB approval from MSU, and we are getting similar from the hospital. Then we will obtain the data. Hopefully we will do chart review and data collection through that way. So they don't really need you to go in much details because the interview itself, you can correct me, Mulham, they will try to see how you are doing, your communication skills, your way of answering questions, and then what you are doing is the steps that you are doing. They don't literally need the details of the details unless there is a specific person who likes the details. But during the interview, they want to get the idea of. So if you show them that you know what you are doing and what's required from you by the end of the fellowship, I think that's the goal. Doing it in the details of might not serve them a lot. They want you to show them that you are a hard worker and you know what you are doing, basically. If I'm making this
Yes,
myself.
it does. Thank you so much.
You're welcome. Mulham, you want to add something, or? Sorry, someone else wants to add or ask question? Ali, I
yes.
Yes,
Can you hear me?
Yes.
So I have a suggestion, but first, allow me to thank Omnia for her presentation.
Sure.
It was really interesting, especially the talk about letter to the editor. It was a new concept to me. So thank you, Omnia. About suggestions, I don't have a suggestion for the next meeting. I think there are some priorities for the interview and so on. But for me, I find it difficult to understand some graphs shown in the results, especially those with confidence interval and the complicated one. So I think maybe in the future, we can have a presentation or discussion regarding how to read the graphs in the results part. Also, I would like to thank Mulham for sharing his experience. Honestly, initially I was telling myself that you don't need to worry about the match at this time, and that you are not applying this year and so on. And you need to focus more on step 2 CK and so on. But as Mulham said, you really need to prepare for the match earlier. So I'm really grateful for this opportunity to be in this program with all of you. Thank you, Dr. Nader. Thank you, Mulham, and thank you all fellows for sharing your experience and your worries and your concerns regarding the match. And I really wish you all good luck in this match. Thank you.
Thank you for the comment, and thanks for the suggestion as well. Any other suggestion for next week or in the future? Anyone wants to volunteer maybe for next week? And then we can talk about the topic. You can select. So there are a couple of options we can think about. One of them is I piggyback to what Omnia mentioned. I'm thinking of a physician who was here in MSU. He is retired. His name is Henry Barry. He is a good example for someone who went through the residency and the whole nine yard until become a professor in the field of family medicine. But maybe we can talk about him and see what he did. I'm interested in looking at some of the literature from his point of view. Since the 70s, he started the residency, and then he started doing some publication. And for the last few decades, he and two others were on, I'd say, a regular publication base. I'm not sure if monthly or bi-monthly, but it's a regular in a well-known journal. And what he does is summarizing things for the regular busy family doctor. So we can look at his approach to things and see what he is doing, maybe in 15 to 20 minutes, and then we can discuss about the applicants' aspects and interview tips and experience. What do you think? Ryan?
Yeah, that's a good idea.
Okay. Anyone wants to? Yeah, go ahead. Someone. Marwa?
Yes, I missed the name of the professor.
Henry
You said his
Barry.
name first.
Henry Barry.
Okay.
He's with a family medicine department, if you look at the website.
Okay. All right.
I'd like to have some volunteers from the people who didn't present before, just to look at
Maybe
what he
I
did.
should then.
Okay.
Okay.
You want to tackle him? Then look at his CV, look at his publications, and give us a summary of his story and how he managed to get what he's doing, and analyze what he is. So it's just a skill that maybe we can look at it and learn from him.
Okay.
Okay.
I will do it.
Sounds good. Thank you. If you have questions, let me know. I can help you, or if someone else wants to involve, that also an option. Thank you.
Thank you, Prophet.
I appreciate it. Any questions, any suggestions, any comments or concerns?
Where's his CV? The doctor, Dr. Harry?
You might find it online. If you can't find it, I will be happy to furnish it, but he has a lot of publications. If you look at PubMed, you can find his publications, and there are other websites. I forgot the name of the...
Nadir,
Yes.
are we talking about Henry Very Vaughan? This is the same person, or
I can share with you.
just his name? Because I looked it up. It's an American epidemiologist in University of Michigan, School of Public Health. I don't know if this is a person or no.
Henry. Actually, I might have him here.
I think, yeah, better try the name in the chat, because there is another name from Michigan as well, and it looks like he has.
Yeah, it's a common name, but he is from the family medicine department. He's a family physician for a long time. I want to give you his... Oh, okay.
It was in Maryland?
So, Henry. My internet is going slow. Henry Berry, is it Berry? No. It's on the I will send it in an email for you guys. So my search is just slow, so I don't want to give you. But he's a good guy, and actually he is one of the. When I wrote the proposal for this fellowship, he is the one was mentoring me or helping me with writing the draft for the award to be funded. We worked together. He was my doctor and my wife's doctor as well when he was working. So, okay.
I think his first name is Andrew Henry Berry.
Maybe, yeah.
Yeah, Andrew
Yes.
Henry Berry, who works
Yes.
in Michigan.
Mm-hmm.
Yeah, I can write the name from the chat. Most likely he's the one.
Okay, let's see. Actually, I can do it.
The picture is an elderly man, so I think he is the one.
Okay. So, Marwa, if you have questions, let me know. And then I will send you a PDF of his CV if I find it. Okay.
That's great. Thank you.
Good. Any other questions? Any other comments before we?
Yes, Dr.
Yes.
Nadir, Omnia.
Go ahead. Omnia, go ahead.
I will send you the presentation in your email so you can upload it to the application.
That will be great. That would be great. Thank you so much. I really appreciate it. Yes, and that will be helpful for the future.
Okay.
Excellent. Okay. Thank you, everyone, and really appreciate the presentation and input from Mulham, your experience and your tips and the questions and comments from everyone. And I wish you all the best in the coming days and in the future. So we'll see you next week. Have a great. Actually, I want to remind you on Wednesday. I sent you an email about department chair and another doctor. They will be presenting some of their research work. If you have time, it will be at 10 o'clock, I think. Check your email, and if you have time at 10, it's going to be also Zoom meeting. That might be a way to look at things. You're welcome. Thank you, everyone, and have a great day or night, and see you next week. Assalamu alaikum.
Goodbye.
Thank you, everyone. Have a good one. Bye-bye.
Thank you.
Thank you.
As-salama. Good luck.
Assalam.
Good luck, everyone.
Thank you all. Goodbye.
Thank you, Ali.
Thank you. Bye.
Thank you, Ryan. Bye.